first we're going to just clean off the skin over your right buttock with this alcohol prep pad, okay? So in addition to the antibiotics that you're taking by mouth, this is the injection of ceftriaxone, which just decreases the risk of infection, okay? So it's going in right now. There you go. All right, so the next thing we're going to do, I'm going to insert the probe, the ultrasound probe into the rectum. And so you're going to feel a little pressure. It's just as if you, and you can see what we're doing there on the big screen. So a little pressure, just like we're doing the prostate exam. We have some lidocaine jelly here to decrease the pain. It's going to feel a little tight, okay? Try to relax as much as you can. There we go, okay. And so I just put on the needle so you can see there's the prostate, that black triangular area above is the bladder. And we use the green dotted lines because that's our guide to inject the lidocaine, which is the numbing medication. And we're going to inject that on both sides. So you're going to feel a little stick, kind of like when you go to the dentist. And that's just the lidocaine going in to numb up the rest of the procedure, okay? We're going to inject to several areas. This is along your right side of your prostate, the nerve along the right side. We're at what we call the apex now, for the tip of the prostate. Now I'm going to go over to the left side. And again, this is going to numb you up nicely for the rest of the procedure. Okay. So the next thing I'm going to do I'm going to latch our ultrasound probe now to our Artemis guided biopsy, fusion guided biopsy device. So you're going to hear some of the noises of the machine here as I manipulate it so that we can put this probe into our cradle, okay? This is the first step to allowing us to fuse the MRI that you had performed to our biopsy. Okay, so now we're going to get started here. So we're scanning in using the ultrasound. We're acquiring the image of your prostate in all dimensions here, okay? That's what you're seeing on the screen. From here on out, it should be less than 10 minutes. Okay, so now I'm drawing red circles around the contour of your prostate in the axial plane, meaning that this is the cross section across the prostate. So now the computer software is taking over. So now I'm going to make some adjustments to fuse the MRI onto the ultrasound image. We're matching the MRI image now to the ultrasound image, and so this kind of lets us align those areas that appear to be of interest. Okay, so again, there's the blue areas are where we're going to sample, in addition to what we call the template. And so in this case, we're going to take 14 total biopsies, one of each one of those blue areas. And it's going to sound like a stapler firing each time I do a biopsy. And then this is target 1. the nice thing as well is the computer's recording this, so we can always go back to an area. Let's say you had a low risk prostate cancer and wanted active surveillance, we can go back to that area in the future. Number 1. This is number 4. So again, we're just doing our 12 template biopsies of the prostate now. A little bit of overlap here with that target with this particular template biopsy. Okay, we're all finished. I'm going to take the probe out now, so that's saving the data from the biopsy so we have it in the future in case we need it. Now you may see some blood in your, from rectum for about 48 hours or so, kind of like hemorrhoids. There may be blood in your urine for up to a week, and you can see blood in the ejaculate for up to 2 months after the procedure, okay?